There's a lot of misinformation, as you just saw, that goes viral on social media, and it's our mission to separate fact from fiction. We know you have a lot of questions, and to answer them, we're bringing back our 9 Health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. So first question comes from a viewer who asks, how long does it take for COVID-19 to enter the bloodstream, and does flushing out your sinuses help?
So nasal sinus rinses have been very effective in treating allergies, chronic sinus inflammation, and they can actually also shorten the duration of the common cold. But there's no evidence that they can actually reduce the susceptibility to the COVID-19 infection. And if you think about it, the virus enters your body through the nose, but it actually enters your cells through the lungs. So it's not clear that nasal irrigation is actually going to reduce the susceptibility to the infection. And in fact, we know that the virus can also live on plastic surfaces. So if you're using a neti pot or using one of those bottles and you inadvertently contaminate that with coronavirus, it could actually increase your risk. So if you have allergies or sinus inflammation, it's good to use those nasal rinses because we know it works for that, but there's no known evidence that it actually makes an impact on COVID susceptibility.
Another viewer is asking about distancing from their partner who is an essential worker while they are staying home. So they're asking, should people keep their distance while at home if their family members are out in the public?
So the way I would think about this is to ask yourself 2 questions. Number 1, what sort of contact does the significant other or partner have? And if it's a high contact job that they're in, then the answer is probably you ought to think about social distancing. And then the second question is to think about your own risk or susceptibility, because that'll help you make the decision as well. So if you happen to be in one of those vulnerable groups, then again, a good idea to socially distance. Now, certainly it's challenging to socially distance in the same house, but there are a few tips. You can sleep in a separate bedroom, use a separate restroom, don't share utensils, sit at the opposite ends of the dinner table. So if your risk is high and or your partner has contact with a lot of people, you probably want to think about socially distancing at home as well.
Yeah, we recently did a story on this doctor dad who was sleeping in the treehouse to keep his kids and wife safe. Of course, it was kind of an advanced treehouse with AC and everything. But yeah, we're seeing a lot of sacrifices made by doctors. Last question for you, Dr. Kohli. A viewer asks about insects. Can mosquitoes and flies transmit the virus to a person?
Yes, this has come up a lot, and the answer is no. We don't think that it's borne by mosquitoes or flies or other insects. When you have Zika virus, for example, that can be transmitted by mosquitoes because it's in the saliva of the mosquito, and the mosquito inoculates the saliva under your skin, and then it gets into your bloodstream. This, on the other hand, seems to be a respiratory virus, so it's transmitted through contact, through respiratory droplets, and through touching contaminated surfaces.
All right, Dr. Kohli, thank you so much for answering some of those questions.